Question 1. A nurse is preparing to administer furosemide for. Which lab value must be reviewed first? A. Sodium. B. Hemoglobin. C. Potassium. D. Magnesium. Answer: C. Potassium. Question 2. Which patient statement about phenytoin indicates a need for further teaching? A. I will brush my teeth daily. B. I must have regular blood tests. C. I will take the medication at the same time daily. D. If I feel better, I can stop it. Answer D. If I feel better, I can stop it. Question 3. Which medication should the nurse question for a patient with a known sulfa allergy? A. Hydrochlorothiazide. B. Ciprofloxacin. C. Acetaminophen. D. Metronidazole. Answer: A. Hydrochlorothiazide. Question 4. What is the most important instruction for a patient starting nitroglycerin patches? A. Keep the patch on 24/7. B. Apply over hair for better absorption. C. Rotate sites daily. D. Store in the freezer. Answer: C. Rotate sites daily. Question 5. A patient taking isoniazid develops numbness and tingling. What should the nurse anticipate? A. Give pyridoxine. B. Stop the medication. C. Apply cold compresses. D. Check calcium levels. Answer: A. Give pyridoxine. Question 6. A nurse receives a new order for 4-potassium. What is the priority nursing action? A. Ensure the patient is NPO. B. Administer via 4-push. C. Confirm adequate urine output. D. Check bowel sounds. Answer: C. Confirm adequate urine output. Question 7. Which finding is a serious adverse effect of clopidogrel? A. Bruising. B. Hematuria. C. Headache. D. Rash. Answer: B. Hematuria. Question 8. What is the nurse's priority when administering 4-amphotericin B? A. Monitor for hypertension. B. Assess for hypoglycemia. C. Pre-medicate for fever. D. Keep patient NPO. Answer: C. Pre-medicate for fever. Question 9. Which medication should be questioned in a patient with asthma? A. Albuterol. B. Fluticasone. C. Propranolol. D. Montelukast. Answer: C. Propranolol. Question 10. A patient with atrial fibrillation is prescribed dabigatran. What should be included in discharge teaching? A. Store it in a weekly pill organizer. B. Take with NSAIDs for pain. C. Keep in original container. D. Crush before taking if needed. Answer: C. Keep in original container. Question 11. What is a key teaching point for a patient taking colchicine for gout? A. Increase dairy intake. B. Avoid grapefruit juice. C. Take at the first sign of a gout attack. D. Limit fluid intake. Answer: C. Take at the first sign of a gout attack. Question 12. Which action is most appropriate before administering an opioid to a patient with COPD? A. Offer high-protein snacks. B. Encourage deep breathing. C. Check respiratory rate. D. Assess for pain only. Answer: C. Check respiratory rate. Question 13. A patient receiving levothyroxine asks when to take the medication. What is the best response? A. Take with your other morning meds. B. With food to reduce nausea. C. Take in the evening with dinner. D. Take in the morning before food. Answer: D. Take in the morning before food. Question 14. A patient on linezolid develops a headache after eating cheese. What should the nurse suspect? A. Hyperglycemia. B. Hypertensive crisis. C. Allergic reaction. D. Tardive dyskinesia. Answer: B. Hypertensive crisis. Question 15. A nurse is giving 4-lorazepam for status epilepticus. Which assessment is the priority? A. Respiratory rate. B. Urine output. C. Pupil size. D. Grip strength. Answer: A. Respiratory rate. Question 16. A patient with bipolar disorder taking valproic acid reports fatigue and bruising. What is the next step? A. Administer vitamin K. B. Check liver function tests. C. Start iron supplements. D. Encourage fluids. Answer: B. Check liver function tests. Question 17. Which patient statement about atorvastatin requires intervention? A. I will report any muscle pain. B. I'll take it in the evening. C. I can stop if cholesterol improves. D. I should avoid grapefruit juice. Answer: C. I can stop if cholesterol improves. Question 18. Which medication should the nurse question for a pregnant patient? A. Methotrexate. B. Ferrous sulfate. C. Folic acid. D. Insulin lispro. Answer: A. Methotrexate. Question 19. Which lab value should be monitored during long-term corticosteroid therapy? A. Serum glucose. B. INR. C. Sodium. D. Hemoglobin. Answer: A. Serum glucose. Question 20. A patient is prescribed gentamicin. What is the nurse's priority assessment? A. Skin turgor. B. Urine output. C. Bowel sounds. D. Capillary refill. Answer: B. Urine output. Question 21. A patient on gentamicin reports ringing in the ears. What is the nurse's priority action? A. Hold the dose and notify the provider. B. Administer with food. C. Encourage hydration. D. Reassure the patient it is temporary. Answer: A. Hold the dose and notify the provider. Question 22. Which instruction should be emphasized for a patient starting metronidazole? A. Avoid alcohol during treatment. B. Take with an antacid. C. Expose to sunlight for vitamin D. D. Stop the drug if urine darkens. Answer: A. Avoid alcohol during treatment. Question 23. A nurse prepares to administer methylorgonavine to a postpartum patient. What condition is a contraindication? A. Uterine atony. B. Vaginal bleeding. C. Hypertension. D. Bradycardia. Answer: C. Hypertension. Question 24. What is the expected action of naloxone when given to a patient with opioid overdose? A. Decreases pain. B. Reverses respiratory depression. C. Induces vomiting. D. Prevents withdrawal. Answer: B. Reverses respiratory depression. Question 25. A nurse teaches a patient with asthma about using a corticosteroid inhaler. Which statement is correct? A. Use it for acute attacks. B. Rinse mouth after use. C. Use before bronchodilator. D. Expect a bitter taste. Answer: B. Rinse mouth after use. Question 26. Before administering epoetin alpha, what is the most important assessment? A. Temperature. B. Blood pressure. C. Heart rate. D. Oxygen saturation. Answer: B. Blood pressure. Question 27. A patient on long-term PPI therapy should be monitored for A. Iron deficiency. B. Hypernatremia. C. Bone fractures. D. Hyperglycemia. Answer: C. Bone fractures. Question 28. What finding requires immediate action for a patient receiving heparin? A. Bleeding gums. B. Black tarry stool. C. Occasional bruising. D. Mild epistaxis. Answer: B. Black tarry stool. Question 29. A nurse administers glipizide. Which action is most important? A. Give on an empty stomach. B. Hold of glucose is under 70 milligrams per deciliter. C. Assess bowel sounds. D. Monitor potassium level. Answer. B. Hold of glucose is under 70 milligrams per deciliter. Question 30. What is the priority action after administering midazolam for conscious sedation? A. Monitor oxygen saturation. B. Keep the patient NPO. C. Assess for GI upset. D. Encourage deep breathing. Answer. A. Monitor oxygen saturation. Question 31. Which lab is essential to monitor for a patient on clozapine? A. ALT. B. WBC count. C. Potassium. D. Creatinine. Answer. B. WBC count. Question 32. A nurse prepares to give sucralfate. What instruction is most appropriate? A. Take after meals and at bedtime. B. Take with milk. C. Chew thoroughly. D. Take 1 hour before meals. Answer. D. Take 1 hour before meals. Question 33. What is the nurse's best action when a patient refuses prescribed medication? A. Notify the provider immediately. B. Document and withhold the dose. C. Insist the patient take it. D. Crush and mix with food. Answer. B. Document and withhold the dose. Question 34. Which condition is a contraindication for receiving a beta blocker? A. Hypertension. B. Tachycardia. C. Asthma. D. Migraine. Answer. C. Asthma. Question 35. Which lab result should be monitored for a patient receiving an allopril? A. INR. B. Sodium. C. Platelet count. D. Potassium. Answer. D. Potassium. Question 36. A patient prescribed rifampin should be taught. A. Avoid dairy products. B. Urine may turn reddish-orange. C. Take only when symptoms appear. D. Expect weight gain. Answer. B. Urine may turn reddish-orange. Question 37. A patient is prescribed spironolactone. What finding requires provider notification? A. Potassium 5.5 milliequivalent/L. B. Sodium 137 milliequivalent/L. C. Pulse 88 BPM. D. BP 118/76 mmHg. Answer. A. Potassium 5.5 milliequivalent/L. Question 38. Which action is essential before administering 4-potassium chloride? A. Push rapidly over 2 minutes. B. Dilute and infuse slowly. C. Give with furosemide. D. Shake the vial before use. Answer. B. Dilute and infuse slowly. Question 39. A nurse is reviewing orders for lithium. Which instruction is correct? A. Increase sodium restriction. B. Maintain consistent fluid intake. C. Take with NSAIDs daily. D. Avoid all dairy products. Answer. B. Maintain consistent fluid intake. Question 40. A patient reports chest pain after taking sildenafil. Which medication is contraindicated? A. Acetaminophen. B. Nitroglycerin. C. Metoprolol. D. Ibuprofen. Answer. B. Nitroglycerin. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.